Hi, I am Dr. Avantika Tripathi, course mentor Dentium. I will be discussing about Dentium Bright Surgical Kit. This is the Bright Surgical Kit. It is used to place both bone level and tissue level bright implants. So these are the components of this kit. These are the initial drills. These are the final drills. These are the parallel pins which are used to check the parallelism after initial drilling. These are the path pins which are used to check the parallelism of implant after final placement. This is the drill extender which is used to increase the length of the drill. These are the implant drivers for bone level implant placement. These are the implant drivers for tissue level implant placement, and these are the hex drivers for prosthetic tightening. These are the final drills. The diameter of each final drill is equivalent to the final diameter of implant, and each final drill is dedicated with a different color. So 3.5 has a color band of yellow on the shank of final drill. 4 mm has a color coding of green. 4.5 has a color coding of blue. 5 mm final drill has a color coding of red. If the diameter of my implant is 4.5, there will be a blue color band on my final drill, and the same blue color will be there on the box of my implant. After preparation of my osteotomy with the initial drills, I will use the parallel pins to check the parallelism of my drilling with the adjacent teeth. This is the parallel pin. The diameter of the thinner portion of this parallel pin is 2.5. So after drilling with the 2.5 drill, I will insert this side of my parallel pin. The diameter of the thicker portion of the parallel pin is 3 mm. So after drilling with the second drill, I will insert the thicker end of my parallel pin. In some inaccessible areas where I feel that I am unable to reach the desired depth, then I will use this drill extension to increase the length of my drill. So I will simply insert my drill on this drill extender, and I can increase the length of my drill. If I want to place an implant of 4.5 mm, I will use the drilling sequence of 2.5, 3, 3.5, 4 and 4.5. If I need to place an implant of 6 mm, there is no 6 mm final drill. So I will use the sequence of 2.5, 3, 3.5, 4, 4.5, 5, and then the countersink of 6 mm has to be used, as the body diameter of 5 mm and 6 mm is same. After completion of my final drilling, I will place a bone level implant with these implant drivers. This is the handpiece driven implant driver. It has a rubber ring which is used to adapt the implant nicely. After complete placement of implant, to check whether my implant's position, angulation, orientation and parallelism with the adjacent teeth is correct or not, I will screw these path pin over the implant to check the orientation, angulation and position of my implant. So there are 2 path pins present in this kit. This is the hand ratchet which is used to tighten or loosen the implant after placement. So it is just simply inserted over the implant driver, handheld implant driver, and we can give forward or reverse direction, whichever is required. This is the depth gauge. This side of the depth gauge has markings of 5, 7, 9, 11, 13 and 15. So after preparation of the osteotomy, if I need to check whether I have reached the desired depth or not, I will just place it along the wall of the osteotomy to check the depth. The other side of the depth gauge has markings of 1, 2, 3, 4 and 5 mm, which helps in choosing the gingival height of our abutment. It is seated, the conical portion of this depth gauge is seated inside the implant, and the level at which the gingiva is lying, that is considered as the gingival height of patient, and that helps in choosing the height of the abutment.